Hello and welcome to our presentation on medical cannabis, alternative therapies for cancer. This presentation is for Naturopathic Oncology, put on by
Allison Murky,
Heidi Albetti,
and Faith Coates.
Please enjoy the show.
As of currently, there is no adopted standard treatment protocol being used in testing. There are only animal studies and in vitro studies with cannabis and cancer cells. No human clinical trials using cannabis has actually been done with cancer patients in the United States, only clinical cases. These are the Arizona guidelines to writing certificates for medical cannabis in Arizona. The patient needs to be a qualifying patient, meaning a person who has been diagnosed by a physician as having a debilitating medical condition. A debilitating medical condition means one or more of the following. Chronic debilitating medical conditions include cancer, glaucoma, HIV positive, AIDS, Hep C, ALS, Crohn's, agitation of Alzheimer's disease, or treating of these conditions. Chronic debilitating conditions or treatments of conditions that cause one or more of the following can also contribute. Cachexia or wasting syndrome, severe chronic pain, severe nausea, seizures, including those characterized by epilepsy, and also severe or persistent muscle spasms, including those characterized by multiple sclerosis. When writing certificates, you are writing something meaning documents dated and signed by a physician, stating that the physician's profession opinion that the patient is likely to receive therapeutic or palliative benefit from the medical use of marijuana to treat or alleviate the patient's debilitating medical condition or symptoms associated with debilitating medical conditions. The physician must A. Specify the qualifying patient's debilitating medical condition in the written certification, and B. Sign and date the written certification only in the course of a physician-patient relationship after the physician has completed a full assessment of the qualifying medical history. Currently, cannabis is available in the United States. 4 states are completely legal, 23 states are legal for medical use, 10 states have decriminalized and made medical use legal, and 15 states have decriminalized. 27 states are still not on board with medical use.
Now, let's discuss the mechanism of action. Medical cannabis has many mechanisms of action that are helpful in combination with other chemotherapy drugs. Medical cannabis has actions such as appetite stimulation, analgesic, anti-neoplastic, sleep induction, and antiemetic. For today's conversation, we'll focus on appetite stimulant, analgesic, and anti-neoplastic. Appetite stimulation. Many animal studies have previously demonstrated that delta-9 THC and other cannabinoids have a stimulatory effect on appetite and increase food intake. There are CBD1 receptors in your hypothalamus, a part of your brain known for regulating appetite, and your body's own cannabinoids usually send the "I'm hungry" message to them. Analgesia. Cannabinoids may also contribute to pain modulation through an anti-inflammatory mechanism. CB1 and CB2 receptor agonists were comparable with the efficacy of morphine on tumors. Another action of cannabis is its anti-neoplastic effects. There's been shown to have a decreased incidence of benign tumors, adenotumors, and hepatocellular carcinomas, including the induction of cell death, inhibition of cell growth, and inhibition of tuber angiogenesis. One study showed that cannabinoid action induces autophagy-mediated cell death through stimulation of endoplasmic reticulum stress in human glioma cells.
Okay, so what types of cancer can respond to medical cannabis? These are all the different types of cancer that can respond to therapy. Breast cancer, colon cancer, leukemia, prostate, thyroid, pancreatic, stomach, liver, and brain cancer. And we will be talking about liver and brain cancer in these next 2 slides. This was a study done in 2014. They looked at cannabis on liver cancer cells in mice. What they found was cannabinoids might exert their anti-tumor effects by the direct induction of apoptosis and can decrease telomerase activity by inhibiting the expression of the TERT gene. This is an example of the molecular changes cannabinoids can have on liver cancer cells. This was another 2014 paper that showed using a combination of radiation and marijuana can shrink brain cancer cells in mice. Levels of evidence. What are levels of evidence? This has to do with how much academic and scientific integrity a study can lend to the particular field of interest. So the level of evidence pyramid is a representation of the levels that can exist. The lowest level is in vitro lab research. It has the least amount of scientific clout, whereas as you ascend in the pyramid, there's more and more. On this pyramid, the highest level is case reports. In other research environments, clinical trials would be the highest level of evidence, but currently there are no clinical trials for medical marijuana in the US, although there are some in other parts of the world. The closest we have to clinical trials are a longitudinal study, the California Men's Health Study, that will be discussed in 2 slides. Here's an example of a paper done in 2008 from Nature that showed that THC inhibits epithelial growth factor-induced lung cancer cell migration in vitro, as well as its growth and metastasis in vivo. They characterized the effects of THC on the EGF-induced growth and metastasis of human non-small cell lung cancer using in vitro models. They found that these cells express the cannabinoid receptors CB1 and CB2, known targets for THC action, and that THC inhibited EGF-induced growth, chemotaxis, and chemoinvasion. This is a paper published in 2003. The California Men's Health Study, 2015, California Men's Health Study was a retrospective longitudinal study analyzing data for over 30 years in men in California. What they found was cannabis use may be inversely associated with bladder cancer risk in this population. Okay, this is some animal research. This is a 2011 paper showing that CBD inhibits human breast cancer cell proliferation and invasion through differential modulation of the extracellular signal regulated kinase ARK and reactive oxygen species pathways, and that both pathways lead to the downregulation of ID1 expression. We know that mechanistically, ID1 gene expression reduces metastatic spread of neoplasms. And so this is a review, actually a meta-analysis showing that cannabinoids were superior to other forms of antiemetic therapy, suggesting the multifactorial benefits of using cannabis for cancer patients.
Now let's talk about the pros and cons of using medical cannabis. Safety profile. Cannabis is category C. Some studies indicate that cannabis is efficacious in cachexia and nausea in cancer patients, but safety is questionable, especially in long-term use, according to the studies. An overall level of evidence score cannot be assigned to cannabis for nausea and vomiting in cancer patients due to insufficient data. Cannabinoids have been made into pharmaceutical drugs, including dronabinol and nabilone, which are category A. These cannabinoids are efficacious and safe enough to earn FDA approval for nausea and vomiting in cancer patients. An overall level of evidence score cannot be assigned to cannabinoids due to insufficient clinical research. Reasons to recommend cannabis include everything that we've already mentioned in this presentation, including the analgesic effects, appetite stimulation, and anti-tumor. It can also treat nausea and vomiting associated with chemotherapy drugs, neuropathic pain, and glaucoma. Medical cannabis has many cannabinoids, and each cannabinoid has a different therapeutic effect. This graphic shows a summarization of some of the cannabinoids that have been researched and some of the things that they do, including their anti-cancer, anti-inflammatory, even antifungal properties. All of this depends on how the plant is processed and how it is used. Here are some reasons not to recommend cannabis. For one, like we said, there is no standard treatment protocol. There are also toxic effects that can happen, including sleepiness and sleeplessness, as well as anxiety. It can also impair driving skills. There is a possibility of abuse and addiction, as well as overdosing. There can be a compromise to the plants, such as fungal growth, and the risks of using cannabis include an increase in squamous cell carcinoma in the head and neck, and marijuana use has been shown in one study to increase the risk of lung cancer by 2-fold. And this was in heavy marijuana users. Hope you enjoyed our presentation. Thank you so much for watching, and pass it on.